네, 오늘 코로나 현황 보겠습니다. 국내 신규 확진자 59명인데요. 이 지역 사회 감염이 39명, 해외 유입이 20명입니다. 이 지역 사회 감염이 거의 배에 가까운데 서울 수도권과 광주 광역시에 집중되고 있습니다. 서울 송파구 사랑교회 관련 확진자는 11명 추가됐습니다. 이 소모임이나 예배를 볼 때 방역 수칙을 잘 안 지켰다는 조사 결과입니다. 경기도 포천 군부대 관련 확진자도 17명으로 늘었는데 부대를 방문했던 민간 강사가 전파 고리로 추정됩니다. 전 세계 확진자 수는 1,540만 명에 육박하고 있습니다. 미국과 브라질, 인도, 러시아, 남아공 이 5나라가 전체의 56%에 이르고 있습니다. 미국 확진자는 410만 명을 넘어섰는데 미국 상황은 양영은 기자가 더 자세하게 전해드리겠습니다.
네, 매일같이 전해지는 미국의 코로나 상황 얼마나 심각한지 궁금하시죠? 예고해드린 대로 오늘은 미국에서 코로나 환자들을 직접 진료하고 있는 한 의료진의 인터뷰를 전해드리겠습니다. 세드릭 다크 씨인데요. 현재 텍사스의 한 대학병원에서 응급의학전문의로 일하고 있습니다. 텍사스주의 코로나 입원 환자는 1,800여 명 정도인데 미국에서 가장 많다고 합니다. 다크 씨는 미국이 보다 효율적으로 코로나를 통제할 수 있는 기회들을 놓쳤다면서 특히 마스크 착용을 둘러싼 정치적인 대립 그리고 문화적인 거부감이 경제 재개와 맞물려서 코로나를 재확산시켰다고 안타까워했습니다. 이번 인터뷰는 화상으로 사전 녹화했습니다. 함께 들어보시죠.
Thank you very much for joining us today. Has the number of patients increased recently at your hospital?
Yeah, at our hospital, those numbers have been steadily going up. We get reports from our department chair usually every weekday, and the reports he gives us, those numbers are going up all the time. One of the things that I think people ought to understand, especially in Texas, we had a baseline back in April and the beginning part of May, and after our governor decided to reopen the economy kind of at a breakneck pace, we've seen that our numbers skyrocketed. We have 10 times the cases that we did back in April. We have 7 times the hospitalizations we had. We have about 5 times as many deaths. And it's purely because we decided to open the economy in a manner that just was not wise and educated. Without the countermeasures necessary.
So can you give us some insight on what you're seeing in Texas and other hospitals in the nearby area?
And I have friends that are in what we call the Rio Grande Valley. It's near the border between Mexico and the United States. And I think the stories coming out, especially out of the Rio Grande Valley, are very scary, where there are, patients kind of lining the hallways. Every single bed is being taken up in the ER. It's pretty sad, the situation that we're in, and I have a friend in Arizona, which is west of Texas. He was actually in New York as well. And like that situation that's going on in Arizona now is starting to be like what was happening when he was in New York. And I think the sad part is we've had so much time, whether it was the experience in China, the experience in Italy, the experience in New York, that you think that people would have learned the lessons of what you need to do to get this under control. But we just haven't really paid attention to those lessons. And those lessons obviously for the public are stay home if you can, socially distance if you have to go out, and if you have to get close to somebody, make sure you're wearing a mask. And wearing a mask is like a huge cultural thing that doesn't exist here in the United States, and it's something that I really wish we would get culturally, because it's got such a effectiveness in being able to reduce transmission and being able to keep people safe.
What do you think caused the sudden increase in COVID-19 infections in the U.S.?
Yeah, I mean, it's been very frustrating, I think, as a physician, to see the amount of polarization that has happened from the political perspective, and also sort of the distrust of science. We've seen this before, right, when it comes to things like vaccination, where people don't trust vaccination. But something like wearing a mask, I can't comprehend why it's so difficult. It's not like we're asking you to inject something foreign into your body. We're just asking you to put something over your face so that your germs don't spread, or so that you don't breathe in somebody else's germs, because as I said, like with the patient that I had that was completely asymptomatic, you don't know if the person sitting next to you has this disease or not. If you get this disease and then you carry it back home, you're going to harm your family. I've seen, reports about people going to bars, people going to clubs, and it's infuriating that people are thinking about short-term fun when realistically we have a long-term pandemic to deal with.
What are some difficulties that come along with being a doctor that cares for COVID-19 patients? I mean, personally to you.
I think the biggest difficulty, honestly, both my wife and I are emergency doctors, and so we always have a very difficult schedule, but we've never had to deal with the thought of bringing something deadly home to our child. And I think that's one of the most difficult decisions that almost every physician has had to make, is what do you do in that instance? I've had friends that essentially sent their families away for a couple of months or a couple of weeks to make sure that they didn't get them infected, especially at the beginning of the pandemic. There's stories of physicians that have, rented RVs or other vehicles that they might park outside their house so that they could stay kind of isolated there. I live far away from most of my immediate family, but my wife we live in the same town with my mother-in-law, and so we've had to, especially early on, stay away from them because they're older and in that high-risk group, and we don't want to be around them and risk getting them sick, because that would be something that's very difficult to have to live with, thinking that you brought home something deadly to one of your loved ones.
So as a doctor, can you advise us on good habits to implement?
Yeah, the best things you can do, number one, is stay home. And limit your interaction with other people. When you go out, especially if you're around strangers, this is a time where, stranger danger, which you used to teach kids all the time. That's an important thing to think about as well. Try to stay your distance from people. Even if you know who they are, if they don't live in your household, try to, maintain 2 meters, 6 feet away from them. Wear a mask, and constantly wash your hands. Try to avoid touching your face. The thing that makes it very difficult is we have patients that look totally normal, that feel totally normal, that still could be spreading the virus. And that's the most dangerous aspect, I think, of this, because it's very sneaky. COVID is very different from the common cold just in terms of what it does to your body. It's deadlier than, obviously, a common cold, deadlier than the flu. We don't really know how much deadlier it is, but it is deadlier. And we'll know more as the data develops. But it also does a whole lot of weird things that, frankly, as a doctor, are completely new. Everything's completely new to what we're experiencing. It's giving people blood clots. It's giving people things that look like vasculitis. It does this weird stuff to kids. None of this stuff is in any of these books on the shelf. Completely new. So I don't know. I just know it's deadly. It's insidious because unlike most colds, people have symptoms and then they cough on you and then you get the cold. Here, it literally, I saw somebody shot in the chest and then later on told they got COVID. It just goes to show you that this disease is out there and it's being spread in a very insidious manner if we don't take it seriously.